Hi, I'm Dr. Valerie Moulds with Pinnacle Vision Care, and I'm here to talk to you about dry eye syndrome today. What are the symptoms of dry eyes? Many of you come in complaining about foreign body sensation, grittiness, pain, tearing. Tearing is a confusing symptom that a lot of patients come in with. How can I be dry if my eyes are tearing all the time? Well, tearing is a protective reflex that kicks in when your eyes become critically dry. What happens, for instance, if you're staring into a blowing fan or an air conditioning vent? Your eyes will begin to water. That's not water blowing in your face, it's dry air. So when the surface becomes critically dry, the message is sent to the brain that the eyes need help, they need lubrication. So reflex tearing kicks in to help protect the surface of the eye, known as the cornea. It protects it from drying out further. So in a healthy eye, the cornea, which is the skin of the eye, should be covered by a nice, thick, stable tear film. The tear film provides two services to the cornea. Number one, it's a lens to help keep your vision stable and clear. And the second service is to protect the surface of the eye from the air and everything floating in it, whether it be pollen, dust, smoke. A lot of people don't understand that the tear film is critical in keeping the vision clear. They feel that if they don't feel uncomfortable, that they must not be dry. But nothing could be further from the truth. So what causes dryness? Age is the number one cause of dryness. As we get older, we tend to dry out. Our skin dries out, our hair dries out, and so do our eyes. It's no different. The lacrimal gland, which sits under the brow bone, is not necessarily 25 years old anymore in someone like me. But as that lacrimal gland starts to age, it's not producing that moment-by-moment lubrication that you need to maintain the stability of the tear film. So as we age, the tear film becomes thinner, and you start to experience those symptoms we talked about more frequently. If you're not using lubrication on a regular basis, you'll start to feel the effects of dryness. You'll start to see it affecting your vision, especially when you're doing activities like reading, computer work, watching TV, or driving a car. Why during those activities? Because when you're doing those activities, you're focused on what you're doing and you don't realize it, but you're not blinking as often as you do normally. So the longer you stare, the drier the eye becomes because that dwindling tear film is evaporating right off the eye. And sometimes patients will notice that. They'll notice that their vision gets blurry or runs together. These are common complaints that we get with patients who are noticing this. Now, not everyone will notice it affecting their vision, but eventually as the dryness works its way past the top two layers of the cornea and works its way into that middle layer where the nerve ending is, then when it hits the nerve ending, the message goes to the brain, help, we're too dry, we need help, and that's why you get reflex tearing. That's also the problem with waiting until you feel pain to treat dry eye syndrome. If you're waiting to feel pain, what you've actually waited on to happen is for the tear film to evaporate into thin air. You've waited on the top two of only 5 layers to dry out completely, and oftentimes that affects the optics of your vision as well. And now you're halfway through the corneal thickness before you realize, oh my goodness, my eyes feel uncomfortable, I must need drops. At that point, you've been dry for hours. That's why you don't go by how you feel. If you're 40 or older, I promise you're drying out, whether you realize it or not. Think about your skin. Your skin, when it starts to become dry, is not painful. The only way you know you're dry is because you happen to look down and notice the flaking, the peeling, the dryness. So why do you moisturize if you're not uncomfortable? If you use that analogy, then it doesn't make any sense to wait to feel dryness in your eye. You should be proactive. And if you're treating dry eye appropriately, you'll never feel the symptoms of dry eye, and you'll be able to keep your vision stable as well. A couple other points I wanted to talk on: medications. Medications affect dryness. Blood pressure medication, thyroid medication, hormone replacement therapy, anti-anxiety, antidepressants, and over-the-counter cold and allergy medication all act on mucous membranes as far as drying them out. We don't take patients off these medications because their eyes are dry. Clearly that wouldn't make much sense, but if you have to be on those medications, it's more critical for you to be faithful with your lubricating schedule, because you have a little bit more of an uphill battle there with the dryness. You have to be cognizant of that. The other thing is that as women, we dry out 9 times faster than most men do. There is a hormonal difference there that affects dry eye syndrome. So just in closing, I want to make sure that you understood the symptoms of dry eye syndrome, the importance of regular lubrication. Don't wait until you feel symptoms to treat. Make sure that you're using your artificial teardrops on a regular basis. And if you feel like they're not enough, then talk to your eye doctor. There are heavier products that can be used. There are medications that can be added. There's always something else that we can usually do to help get you to that level of comfort and to keep your vision clear. I'm Dr. Valerie Moulds of Pinnacle Vision Care. Thanks for watching. Stay tuned for more videos in the near future. Thank you.